Hopefully that gives you a quick overview of edibles. We tried to cover a lot of territory. It's not a complicated subject. One that I have to tell you, people really love the products. They taste good and they're tempting to take a lot of the snack. Don't suggest snacking, suggest treating them like a medicine, but they're very effective, especially for sleeping at night and addressing pain management. People have found that edibles really are something that have helped them and are very effective. And again, once you learn your effective tolerance level, your dosing tolerance level, whether that's 2 milligrams of THC, 5, 10, whatever it is, you can then adjust the CBD ratios to that and be able to just hone in on the types of edibles and the concentrations that you need to address your particular condition. That being said, let's jump into some of the questions that were asked prior to this particular webinar starting, and we'll answer your questions. And please, again, feel free to answer any questions that you might have. Let's jump into the first question that's here. I have trouble figuring out how much cannabis to decarb and to use in recipes. My edibles and butter are always weak. Well, it's interesting. By the way, there's a related subject or question that came in, and that's using my own flour to make edibles. It sometimes is a challenge to figure out how much dosing. Any hints? So here's kind of the formula that I follow. When I take a look at making a product, what I tend to do is I try to figure out how much cannabis I would like to put in the product, how much I want to use, whether that's 3.5 milligrams or 7 milligrams of product. That's what the important part is how much to put in there. Now, in my particular case, I'm extremely tolerant to THC. So what I do is I get 7 milligrams of ground flour. I grind it a little bit more, not a lot, just a little bit, because you can overgrind and you can make it too powdery. Just grind it down a little bit, and I use that in the products that I have. I have to tell you though, when I make brownies, especially for other folks, I tend to use 3.5 milligrams, and that tends to be just about enough to be able to provide the edibles that they want. And if they need more of them, they can actually eat two brownies. But most of the time, I would say starting with about half a brownie to a brownie, and I would say I'd start with 3.5 milligrams would probably be a good recipe to be able to start that's really out there. Now, I do have to point out that Sherry has a calculator, and that calculator works great. There's a link to the calculator on this particular, let's see, it's on the slide down here. And if you use the calculator, what it does, it helps you decide which products, how much, and you can see you can see right here, different things that are popping in there that we're able to fill out and to be able to use. So Sherry Cannabis has this particular calculator that's there. It's really very, very helpful. And if you look at the certificate of analysis on the side of the product that you buy, it'll give you the milligrams that are there and the concentrations of the different cannabinoids and terpenes that you'll be able to use. So that'll give you the guide that's there. Now, if you have your own flour, I don't know what number to use because I don't know what it's been tested to. Unless you've had some testing done, you wouldn't necessarily know that it's there. But I would typically follow this particular formula. If you have a scale, weigh out your 3.5 milligrams or your 7 milligrams of flour that you grow yourself. Start with the 3.5 milligrams, use that product, grind it, put it in the product, and see what kind of effect you have. If it's still too weak, then up it to 7 milligrams or 7 milligrams of product on the next batch that you make, or make a half a batch. That's the best way of doing it. Try it that way, see what the concentrations are. If it's not enough, then you can obviously make the other half of the batch and add some more cannabis to that. But in your case, in the case of when you make your own flour, it's going to have to be kind of some testing that has to be done on your part to figure out the potency of the product that you really have. But I would start with playing with 1.5 milligrams or 7 milligrams. Probably start with 3.5 milligrams. Target 2 to 5 milligrams of THC, and then see exactly what's going to happen. That could help you quite a bit. And again, Sherry is a great resource. She's probably, I consider her the Martha Stewart of cannabis cooking. It's something to really take a look at. So let's take a look at the next question that comes out. How can patients with lupus and rheumatoid arthritis get started with cannabis? Would it help? Absolutely. I cannot tell you the number of patients that I work with that have arthritis over the 10 years that I've worked with medical cannabis and a number of patients. Arthritis, along with pain management and anxiety and stress, are really the top three reasons that I see people using arthritis on a regular basis. It works very, very effectively. And I have to tell you, you typically want to use a higher concentration of CBD the THC along with these particular cannabinoid or terpenes right here, the beta-caryophyllene or caryophyllene, myrcene, linalool, and pinene. Pinene is good to use. However, if you have short-term memory issues, I would not worry about using pinene. I could leave that off the chart here. But linalool, myrcene, beta-caryophyllene definitely will do the job. It'll help with the joint swelling, the redness. It'll help with the pain, and basically give you a lot of the movement back in your fingers and in your hands or whatever is there. I do have to point out that it's not going to get rid of the arthritis. It'll reduce the amount of inflammation. It'll reduce the amount of pain. It'll help you quite a bit. It's not going to get rid of it, but it'll probably give you approximately anywhere between 50 to 80% of your mobility back, which really is a huge help compared to where you were before. So I hope that helps a little bit to understand it. Now, how do you get started? Get yourself a medical marijuana card. Go to a dispensary. You'll get a recommendation. Go to a dispensary and ask for a consultation. Every dispensary, especially if you're using dispensaries like Air or using dispensaries like Sotera, they will give you and they will do a consultation for free. You just walk in and ask for them. And what they'll do is they'll walk you through the products that they have that will address your particular situation. And I think that's kind of the best way to approach it. So you not only have the right products to use, you have one of the dispensaries recommending the products, and you're focusing in on the terpenes that you need. So my recommendation is get your card, go to either Air or Sotera, start with a consultation, and then start with the product that they recommend in for their particular dispensary. Again, you may want to use edibles, you may want to use tinctures, you may want to use smoking. This depends on your route of administration. But the best way to start is really consulting with your dispensary on the product that they have that can help you with your particular condition. I hope that helps a little bit. Okay, does cooking cannabis at a low temperature help to maintain efficacy? What are making ice items like pop? What about making ice items like popsicles? Well, first of all, cooking with low temperature does in fact help the efficacy. Cannabis is very sensitive, especially the terpenes. If you notice here, are very sensitive to temperatures. Now, notice over here, to get the most out of your terpenes, stick to about 356 degrees. And if you'll notice, if, for example, when you make brownies, they tell you to cook brownies between 310 and 325 degrees, which really helps bring out the best of the terpene profiles that are out there. So the answer is yes. Yes, stick with the low to medium heat. Naturally, you have to pay attention to making sure that the food is cooked correctly. That's why the 325 or 350 that's there. But it'll really bring out the right terpenes for you and the right cannabinoids to help you with your particular issue. So yes, the answer is yes. The temperature is very, very important. Don't cook over 350 if you're in fact going to cook anything, because you're going to probably burn off a lot of the terpenes. Just cook it a little bit longer. Instead of 30 minutes, maybe 40 minutes or 45 minutes, and use a meat thermometer or a cooking thermometer for your cookies or for your brownies or whatever to help you with that particular situation. Let's talk about using it. Can you use it if you make an ice product? And the answer is yes. Cannabis can be eaten by itself. In fact, in the case of, there's a case I read about how in the Civil War, they actually were giving cannabis to wounded patients to help them be able to address their pain and a lot of the suffering that they were having in the field. And so the answer is yes, you can eat it by itself. It doesn't have to be heated or cooked. It acts as a natural fiber. I have seen it, believe it or not, in popsicles. What people have done is they've made little gummies, or they made little brownies, just like you have like a popsicle that you've seen commercially, and they'll put them into the popsicles themselves. Or they'll actually take a liquid, a cannabis infused liquid itself, freeze it, and make popsicles out of that. And with the new cannabis, there's some cannabis products that are THC infused alcohol. I didn't say alcohol, THC infused drinks that you can get from people, that you get from a lot of liquor stores now. They have THC in them, not alcohol. And those products, when mixed with other things, make great candy bars, make great popsicles that are out there. So the answer is yes, you can absolutely do that. But make sure you have a product that is infused correctly, does have the right cannabis in there, does have the right THC levels, and again, addresses your needs that you have that are out there. I think one of the things that you're going to find in the future is going to be, how should I say, a lot more broadening of the range of food selections that you can get from cannabis itself. So anyway, we'll take a look at how that is. Let's run to the next question and see what they have here. Can you use RSO straight from the tube into the brownie mix prior to baking? What other tips on using RSO FSO for edibles? The answer is yes, you can. One caution on RSO: do not smoke it. Do not put it into any smokable form. That's not it's not good for the RSO and it's not good for you. Okay, just leave that alone. But many people use RSO straight in from the tube into the brownie mix. In fact, that's one of the preferred ways of cooking that Nurse Amy really recommends. She prefers the RSO straight from the tube to make her brownies. I prefer the actual cannabis itself and grinding it up. Call me old school. So I guess that's just the difference in the way you want to approach it. The answer is it works very well. Now, here's the caution to be careful. If you're taking it straight from the tube, make sure that it is mixed, thoroughly mixed up in your brownie mix. A lot of times that tube version of the RSO is fairly thick. You put it in there, you got to really stir it really well. Maybe over stir it a little bit to make sure that it gets evenly distributed throughout the whole mix. One of the biggest problems you have in making brownies is you have a high concentration of cannabis in one part of the brownie, but not the other. So again, mix them up very well. Make sure you have it very mixed through the whole thing. And the answer is yes, you can in fact use it. And that's one of the highly recommended ways of using or making brownies is using RSO oil directly from the tube. Other question is there a faster way to infuse the cannabis into butter and oil? Seems like it takes a long time. Well, got good news and bad news. The answer is you may be able to cook it a little bit faster, but the answer is not really. It's kind of like, I don't know, it's kind of like cooking a chicken, kind of like cooking a steak. It's kind of like cooking a nice croissant or a loaf of bread. It takes a certain amount of time for all the ingredients to really work together and to be able to work. I've not found any fast track ways of making the butters and the oils. The oils that I make my own tincture oil, and that oil takes me about 8 hours to 10 hours to make. And I know it's made correctly. I don't know of any shorter way of doing that safely to be able to product that you want. I do know people that have short tracked it and really not got the quality or the consistency that they wanted from the product. So again, I would stick to the actual times that are recommended that are out there. What you want to do is you want to make these things, make sure they're thoroughly cooked, just like any other thing that you're cooking, whether it's things you're preparing for your meal to eat, your table, or for your kids or whatever. Make sure the cannabis product is cooked correctly at the right time and with the right distance and at the right temperature. That's why your cooking thermometer is important to make sure the product is in fact cooked correctly and ready to go. Now, can cannabis be used if it's not cooked all the way? The answer is yes. Is it going to cause a problem? Probably not from the cannabis standpoint, but some of the ingredients that you are making it with could be bad tasting, not be completely homogenized, number of things that are really out there. So really get the most out of it. Spend the time to pay attention to the cooking time. You may be able to try to short track it, but I'm not in favor of that. Let's put it that way. Call me old school, but I like to make sure it's done correctly. That's all. Do I need to use sunflower lectin when making chocolate candies and why? Well, the lectin products that are out there, I use a sunflower lectin. I get mine, I get mine from Magic Butter, and I make both brownies. I also make tincture oils, and I do use it. And what it is, it's an emulsifier. What it does, it helps the cannabis and whatever liquid that you're using, whether that's going to be MCT oil or whether that's going to be um, uh, coconut oil, whether either one of them helps it mix better and has a better way of having it homogenize and work together. I have found the reason I use it is it just produces a better product. So is it required? The word need would mean required. It's not required, but I would say it's highly recommended because it'll produce a much better product. When I first started cooking, I didn't use it. I'm almost faithfully use it now, whether it's my brownies or whether it's my whether I'm making brownie smoothies or uh, uh, just in general my tinctures. I definitely use the lectin oil. It's something to pay attention to. Again, the one I use is from Magic Butter, but there's a lot of them that are out there, and Amazon has a wide range of these lectin oils that are out there, not just sunflower, but other products that are also out there as well. Highly recommended to use them. You'll have better results if you use it. What type of marijuana is best to cook with? Oils, ground, or what? First of all, let me make something really clear. Um, don't use expensive cannabis. A lot of people say, I'm going to go buy the best cannabis and put it in my cooking. When you cook it, you're going to change the temperature. You're going to bring out some of the terpenes. You're going to modify that particular product. I always buy the less expensive products a lot of the buds and things like that, because what you're looking for is the terpenes and the cannabinoids. The actual quality of the product really gets, let's just say, blended or lost in the actual product you're making, like the brownie or the gummy or whatever ingredients that you're putting in there. So you don't need a high quality product. Don't buy the premium product, but buy a good product. Don't buy the cheapest stuff. Buy a reasonable product that's there, that has a good COA, that's out there. What is the best? The best is the one that has the terpene profile that matches your particular condition that you're trying to address. Now, if you don't have a particular condition, pay attention to beta-caryophyllene, myrcene, linalool, and also one of the other ones that you need to pay attention to is pinene, which is really good, and linalool. Those are kind of the top ones to really kind of look for out there. Now, um, that terpene profile is really what's best to cook with, and then you can be able to get the product to go with it. A lot of times you'll have right one below the premium products, you'll have some kind of just some regular products that you can get a hold of, usually less expensive, definitely have the terpene profiles and the cannabinoid profiles. That's something to pay attention to, and that I'd really work with right there. Okay, sorry about that. So that's it. Again, hopefully that helps. Um, Again, terpene profile is the key. I can't tell you which strain to use, but talk to your dispensary and they'll actually help you choose the product that you want. A lot of them know if you're cooking to stick to, again, they're not premium products, but a good product that are out there. The other question is, I have a natural high tolerance of 25 milligrams before I feel anything. How do you adjust recipes for dosing? Well, if you have a high tolerance, obviously you're going to use more product. Normally, when recipes are put together, they're put together with the idea of having a 5 milligram or 10 milligram dose of cannabis. So obviously, if 25 milligrams is your tolerance level, you're going to probably want to go 2.5 times or 5 times more than what's being recommended by that particular recipe that's out there. Again, I would just take a look at experimenting with this. I know that when I first started making brownies, I actually took a brownie mix and I broke it into three different batches. I made one batch with one concentration, one batch with another, and the third with a third batch. I just wanted to see the differences and if it made a difference, and that's where I came up with my formula of using the 7 milligrams of ground flour for my particular case. But again, try it yourself, find out what your dosing level is, and again, whatever recipes that are out there, you may want to multiply that by 2.5 times to get your recipe, because they're usually targeted towards a 10 milligram per serving ounce that's out there. Are there any cannabis cookbooks that are available? Yes, and if you look at the presentation that we did, the three that I recommend are from Sherry Sicard. That's Cannabis Sherry. She does a great job. That's there. You notice the one that I provided gave some information from High Times. They have a really good cookbook that's out there. There's a lady named Emily that has a cookbook that's really known. That's really something that people have followed. I didn't put it in the slides, but I know there's something that really people like to pay attention to. But if you just go out and Google cannabis cookbooks, you'll find that there's a number of cooks that are out there. The number of cookbooks are, again, just limited. What I'm looking for in a cannabis cookbook is someone who has a credible name, somebody who's tested the recipes, and somebody that you know you can get more recipes from. And so there are a lot of different recipes that are floating around. For example, Snoop Dogg and Martha put out a couple of cannabis recipes. It's not a cookbook, but it's some recipes that are out there. And if you go out to Google and you do some searching around, you'll find those recipes that are there. And also look at YouTube. YouTube has some cooking shows and things with chefs that are there. They can help quite a bit. You'll also find that there are chefs that'll come to your house or come to your event. They'll cook for you. There's available now, and more are being available across the country. So hopefully that'll help quite a bit. Next question is, I want to prevent. Oh, there's Sherry. I'm sorry. There's Sherry's information that's there, and it's really helpful. That's a good cookbook to take a look at. I think Sherry's cookbook is probably the best in the market right now, and I've seen about 5 of them. So, or I have 5 of them, I should say. I think she's got the best one that's out there. Next question is, can I want to prevent cancer? Uh, can I do that with cannabis? The answer is you can help to mitigate, and you can help to put cancer into remission. Dr. Cristina Sanchez in Spain for 26 years has been studying cancer and cannabis. You may want to look her up. She's done a lot of work, especially in the case of cannabis, use for cancers that relate to ladies, like, for example, with breast cancer and that type of thing. Although she has addressed a number of different types of cancer, both for men and also for women. And the answer is yes. She has shown that what cannabis can do is actually, because it has a neoprotective capability, it attacks the cancer, prevents the cancer from taking more energy than the cells around it, and causes the cancer to die. Now, let me be careful. There are 206 types of known cancer that are out there. In the research that's been done, we know that there's approximately 85 of them that people like Dr. Christina Sanchez and other doctors in Canada, in the UK, in Germany, and in Israel have tested that they know as being effective. They've not tested it for every cancer that's out there. Research into cannabis has been limited, and we really need to do more of it. We know that cannabis works for help to prevent cancer. We know that it's been effective. There's videotapes that Dr. Christine has put together on how it works. But again, it's such a broad area, it needs a lot more research to give it all the definitive answers for anything that's there. If I was diagnosed with cancer, I would definitely use cannabis to be able to address that. In fact, let me just make it real clear. My mother was diagnosed with cancer. She was diagnosed over 6 years ago. And the doctor put her into a panic that she needed to have an operation right away. They needed to get her into chemo and the whole thing, the whole chemo, radiation. She called me in a panic. I stopped that whole panic process. I put her on RSO oil. She's been on that RSO oil now for a number of years. She's still with us. She is in remission, and she'll probably be with us for a couple more years. Now she's not young. She's right now she's 96 years old, but it is working for her, and it is something that I've seen work in a number of different patients. But again, be careful to experiment with this. Cancer is a variable. Cannabis and cancer is being studied. We don't have definitive answers, but we do know that it's an option that has helped a number of people, and it's one that I would definitely take a look at, especially because of some of the draconian methods of they use to attack cancer, like chemo and things like that. It's something you may want to take a look at. Another question is, how much does it cost to get a medical card? Well, medical marijuana card. Well, here I can only address, let's say here in Florida, so let me address that particular question. The medical marijuana, the doctor has to be paid for this particular visit, and the doctor will also, during that visit, put you into the state registry for medical marijuana and give you a recommendation. Now, he's using his license to do that, so the doctor has to get paid. And normally those doctors charge anywhere for by the way, when you look at getting a medical marijuana card, the state of Florida requires you to get a doctor's visit twice a year, first 6 months, second 6 months. Now, typically for the whole 6 months, it runs between $350 and $500 for the doctor's visit. And doctors vary in their charges between that. Most of them charge $199 for each 6 months. Some of them charge $299 for the first visit and $199 for the second visit. But it's approximately around $400 as an average to actually get the doctor to give you the recommendation. To basically, you're using his license to be able to get that recommendation, and the state of Florida requires it. Now, to actually get a physical card, just like you would get a driver's license, that's $77.50 from the state of Florida. So all told, it's usually around about $477.50 to $480 that are really out there. And the best person to talk to and best way to get it is go to the medical marijuana treatment clinics of Florida. They have a number of doctors. They have 22 locations throughout Florida, and they can walk you through the actual cost and the process. Now, cost is not the only thing to look at. I deal with a lot of different doctors, and I have to tell you, the support you get after you get that medical marijuana card is critical. A lot of doctors give you a card on the cheap. I've seen doctors offer cards for $99 and say, see you later. And once you get that card, you don't have a foggiest idea what to do, what your recommendation is, who you should be talking to, what your terpenes are. You're kind of left on your own. What MMTC does is they walk you through a whole process where they walk you through the kind of terpenes you need. They put you in touch with some of the dispensaries that are out there. You have a medical marijuana journey that they have emails that come to you to show you how to walk you through step by step, month by month, week by week, how to use this. They have a personal patient information brochure that'll walk you through all the steps that it takes and all the support. And they have a call center to help you with both not only your dosing, but also answer any questions you might have. So although MMTC is not the cheapest, it's not that $99 solution, it's the $199 solution. The difference is the support, and that support makes all the difference in the world to having you use cannabis correctly to address your particular condition. I'm not in favor of doctors that just give you a card and say, see you later. I really think that cannabis is a journey and they need support and education. Hence why I do these videos. Hence why I have the webinars. But I also think it's important that you understand that it's not just a matter of getting the card. Once you have the card, the question is what to do with it, and that's where MMTC really comes into play, as opposed to some of the other doctors that are out there. They just haven't got the volume to be able to address that. So, highly recommend using MMTC for that. Are there any other questions there, Lee? Great. Okay, so here's some of the questions that were brought up um, during the webinar. Can you see past webinars on the YouTube channel? And the answer is absolutely. Um, if you go to the YouTube channel, you go to youtube.com/marijuana aware, you'll find that we actually break our channel down into how to get started, some of the basics. We talk about the various conditions. We actually have a section on just the Q&As and getting started. So you'll see that there are a number of different webinars that are out there that we've done. And we also have not just the webinars, we also have a number of topics. We call them snippets. These are anywhere between 2 to 10-minute videos that we put out on different subjects that can help quite a bit. So YouTube, the Marijuana Aware YouTube channel, is a tremendous resource for being able to learn about medical cannabis, both the terminology, the components of it, how it addresses your particular condition, how to get your questions answered, and also to be able to have you put together a dosing regime that can really help you get your life back. So the answer is yes, you can. I hope please take a look and let us know how it works for you. Joel asked the question, is it safe or even encouraged to mix different products in homemade edibles? For example, adding a product to chocolate squares for a bar or an amount of RSO oil from a syringe into a muffin or banana mix? The answer is absolutely. Um, it's really important that especially when you're making edibles, you make them for your particular condition. Now, I'll take brownies as an example. I've made them with hemp oil. I've made them with MCT oil. I made them with coconut oil. They have different flavors. They have different textures. The answer is yes, that are there. I have made them with the syringes, the HRSO syringes. I've made them with both the ground products themselves, and also I've used some water soluble tinctures to be able to put it in the product. So yes, you have the capability of mixing and matching different products. Sometimes, if you're looking for a terpene profile, you may want to mix two different types of cannabis together to get the terpenes that you're looking for. But the answer is yes, you can. And I highly recommend it. Remember, when you're making it yourself, you get the capability of really fine tuning it for what you want to do. So please feel free to do that. I do it myself. One of the reasons I enjoy making my products is because it's the way it comes out the way I want to taste, and it comes out with the right terpene profile, the right taste, and the right dosing that's really there. Candidly, it's a lot of fun. One of the other questions that Kathy asked is what terpenes are best for anxiety, depression, and pain? This slide, by the way, or this particular reference is from a webinar that we did last week, or actually a couple of weeks ago. It talks about what are the recommended terpenes for anxiety and stress. And in this particular case, the limonene, the linalool, the myrcene, and the beta caryophyllanes are really, really important. And you'll see on the right-hand side over here with the pain management side, it talks about the different characteristics, whether it's helping with pain relief or anti-inflammatory. It'll really help with both of those. But those terpene profiles work, and it's not, you don't have to get hung up exactly with what strain, as long as the strains contain those particular profile of terpenes, it should work fairly well. Again, the only thing that I would be very careful of is pinene, and pinene is a great terpene. I'm not going to disparage it at all. It works great, but it does bring back short-term memory loss. And so sometimes if people have PTS, it's not exactly the best terpene to be able to use in your medical condition. That's the only one that I put a caution on that you can see that hopefully is there. Let's jump to the next question. It is, where can you purchase canna butter? That is an excellent question. I have not found it for sale anywhere. I can be candid with you. I've gone to a number of head shops. I've gone to a number of dispensaries. I've not found it for sale. I have heard that in places like Colorado, California, and a number of places like that, there are facilities, there are dispensaries that actually make canna butter and sell it. But again, I'm broadcasting from here in Florida, and most of my reference is more of the, Florida, Georgia, Mississippi, the southern type of dispensaries that are here, and I really haven't seen them for sale. So I wish I could answer your question. I wish it was there. Can of butter, by the way, is a wonderful product. It has a lot of it's one of those fun things to put on pancakes. It's one of those fun things to cook with. Just beware, it is cannabis, but it is something that's really fun to play with, and it really helps. It spices up a lot of breakfasts, spices up a lot of dinners, so it's something to really take a look at. But again, I don't know of any place here in Florida. I do find it is available, or I've heard it's available out west. So please pay attention and talk to your local dispensary. If you have any other questions that are out there, we're all covered. Joel, by the way, did mention that he found it. Best place he found it was in Colorado, and that does make a lot of sense. I should point out we have just put out a newly updated medical marijuana patient guide. Down below, you'll see that link to the electronic version, to the digital version, mmtcfl.com/pib. It covers the basics. It covers how to use it. It covers how to get a card, how to be a card, how to be a caregiver. It really is an important guide, including a lot of information on how to dose and the routes of administration. You can get it both digitally. You can also get a copy of it by going to any MMTC clinic. You don't have to be a patient, just ask them for it, and I'll give you a copy of that particular guide. And I should point out that in the guide are discounts from dispensaries like Air, from Cetera, and people like Jungle Boys. They're offering some discount card coupons that are in there. A very important resource for you, and please take advantage of it. Well, we've covered a lot of subjects. We've answered a lot of questions, and I hope that we've answered your question to help you get your life back. I want to just point out that edibles are very effective. They're great not only just for being able to sleep at night, they give you some long-term effect, especially during the day when you have chronic aches and pains and you're trying to manage pain. I recently had an accident where I actually hurt my ribs, and I'm using edibles right now during the day to address the pain for that. It's something that'll take a while to get over, and by being able to get my dosing level correct, I'm able to address my pain but not get high, and that's really, really important. But it's something that I need to do during the day because it's going to hurt all day unless I do something, and I don't want to be popping tincture drops all day, or I don't want to be smoking all day. It's something that really helps. But please feel free to join us going forward. Again, we have our a very special webinar coming up on the 19th of March for not only veterans but also first responders. I do want to mention that Marijuana Aware is a resource for being able to sign up for these webinars. Please ask your friends to join us. Give us your comments about Marijuana Aware. And if you want to get a card, I highly recommend Marijuana Treatment Clinics of Florida. Thank you very much for joining us. I hope that you'll join us for our webinar for veterans and first responders, and we hope we help you get your life back.